Now, with coronavirus, we've suddenly reinvented the way we're thinking of a disease in a completely unprecedented way. In coronavirus, we've been counting every single positive test as a positive case. Now, this is scientifically and medically wrong. You can have a positive coronavirus test and be completely well. You can have a positive coronavirus test and be excreting minimal amounts of the virus. So to conflate positive tests with cases is simply wrong, and yet the positive cases have been driving government policy and the entire panoply of restrictive actions that have been taken.
Well, this is largely a matter of semantics. I mean, you can be a case for all sorts of reasons in science, so long as you differ from the control in some important way. So yeah, of course you can call somebody who's had a positive test a case, regardless of whether they're symptomatic or not. I mean, you have asymptomatic cases. This is not a new term in science. It precedes COVID-19 by quite some time. So, I mean, this is really just arguing about nothing up to a point. It doesn't matter whether you call these people positive tests or infections or cases. The fact of the matter is they have the virus. That's something that's quite useful to know. Not least because the number of cases quite accurately predicts the number of hospitalisations and deaths further down the line. And that's what's really driving government policy. It's quite wrong to say that the number of cases is driving government policy. And you only need to look at the graph that Cummings shows in the film to see that. So you go back to February 2020, there were no cases. You get to March, there's hardly any cases. That's purely because we just didn't have the testing infrastructure. And yet we locked down. Government policy was very clearly not driven by cases per se, it was driven by hospitalisations and deaths. Then you get up to May 2021, the cases start rising again. They peak in July, the government gets rid of all restrictions in July, because again, the government isn't following the number of cases, the population's been very heavily vaccinated, we don't need to worry about cases so much, because as you can see in the graph, it leads to far fewer hospitalisations than before. So it's just not true to say the case numbers are driving government policy. They never have. The only reason they're useful is because, as I say, they predict the number of hospitalisations and deaths. But once vaccines have kicked in, they project and predict a much lower number of hospitalisations and deaths, hence no restrictions.